Health Secretary Francisco Duque defends himself after a Senate panel released its findings on the alleged irregularities in PhilHealth. The Senate Committee of the Whole is recommending criminal charges against Duque and other high-ranking officials of the agency. Let's bring in our Cian Arcangel. Cian, what is Secretary Duque's explanation?
Health Secretary Francisco Duque III disputes the Senate Committee of the Whole's report linking him to irregularities in the advanced payments to hospitals under PhilHealth's interim reimbursement mechanism. Speaking before the joint House committees investigating PhilHealth, Duque calls the Senate's findings baseless. Duque says that while he's the ex-officio chairman of the PhilHealth board, he wasn't involved in discussions on IRM. He adds he was also unable to oversee the IRM's implementation because he was busy leading the national government's efforts against COVID-19. The Senate Committee of the Whole recommended the filing of graft and other criminal charges against Duque over the supposed irregularities in IRM's implementation.
Hindi po ako nakasama sa pag-aaral nito noong unang panahon dahil po sa tindi naman ng aking pong trabaho bilang chairman ng Interagency Task Force na ang amin pong tinutugunan ay yung mismong paglaki ng bilang ng pandemic COVID-19. Talaga pong napakahirap ng ating trabaho dahil maliban po sa akin pamamalakad ng Department of Health as a separate organization from PhilHealth, ay pinangangasiwaan ko pa po ang Interagency Task Force.
A former PhilHealth auditor, meanwhile, testified about a supposed modus that involves faking receipts for contributions of overseas Filipino workers. Former PhilHealth senior auditing specialist Ken Sarmiento says the supposed remittances of some 17 million pesos from OFWs are questionable because they were given fake receipts by hiring agencies. Despite the red flags, Sarmiento claims his superiors never acted on his findings and even had him reassigned.
We can fairly say that meron pong sindikato. We just don't know kung meron pa po siyang third layer kasi po yung skill set needed to manufacture and falsify a receipt is different from the skill of marketing. Nireport po namin to, wala po nangyari. After 3-4 years po of conducting fact-finding, wala pong outcome sa ad hoc committee, wala pong outcome na napakulong o na-apprehend.
The House panels jointly investigating PhilHealth have wrapped up their investigation after 9 hearings. House Public Accounts Committee Chairman Mike Defensor says lawmakers will be filing a bill granting President Duterte emergency powers to fast-track reforms in PhilHealth. He says they will also be filing criminal cases against certain PhilHealth officials based on their findings. Pia?
Hear me, Secretary Duque says he's not involved in anomalies in the IRM's implementation, but what does he think about advancing payments to dialysis centers and maternity clinics, which have been flagged by lawmakers?
Duque says the IRM's implementation is legal and necessary in order to allow hospitals and other medical facilities to continue their operations amid the pandemic. Lawmakers earlier flagged the advanced payments to hospitals and medical centers for non-COVID cases. But Duque points out that COVID is not the only disease that people are infected with at this time, and other medical treatments are expected to continue. And also, some patients may be wary of going to hospitals because of the threat of the virus. Nevertheless, Duque says that the IRM's implementation has been suspended and it will be subject to review. Yeah?
Cian Arcangel reporting.